Hi, I'm Dr. Jan McBaron. Thank you for your interest in my fat-burning injections that we use in my medical practice, Georgia Bariatrics. It has helped thousands and thousands of patients for more than 20 years successfully lose their weight. After all, when you get weighed, you step on the scale and there's fat, fluid, muscle, and bone that all come together to equal the number called your weight. Well, when you want to lose weight, what you truly want to do is only lose fat. So what this fat-burning injection does is it burns just fat for you, so it enhances the quality of your weight loss. And what you'll notice in particular, and we'll talk about it in a little bit, is how many inches this injection makes you lose. You will notice this in your clothes almost immediately. They really work tremendously well. In addition, it's important to note that exercise burns fat, and I applaud exercise, but exercise is limited. There's only so many hours in a day, and if you exercise for an hour, you get 1 hour of fat burning. With our fat-burning injections, you get either 18 to 24 hours of injections, depending on which of the two injections you take. So you can see it really will enhance your weight loss. Because after all, we can only manipulate our calories so much. Fundamentally, we have to burn fat. And the older we are, the slower we burn fat, and the more the injections help you. The other thing about the injection is that they are perfectly safe. They have no side effects whatsoever. They're water-soluble vitamins, and they can be taken by children and pregnant women as well. They're completely safe, even if you take them every single day. And for ultimate fat burning, you could take 2 a day. That's how good these work. So here we have the 2 injections. The smaller one is short-acting. It burns fat for 18 hours. The longer one has more fat burner in it, so therefore it lasts longer. It lasts for 24 hours. So, I'm going to teach you how to give the injection to yourself, and then I'll teach you how to have someone else give it to you if you'd like. But getting these fat-burning injections will make your weight loss incredibly easier. You'll notice several things when you take the fat-burning injection. First, it opens your fat cells and makes your weight loss easier. In other words, it burns fat. Number 2, it decreases sugar cravings and the tendency to binge. It decreases bloating and swelling. It helps you lose inches evenly. You will notice that you lose inches, particularly cellulite. Number 5, it helps reduce stress. Number 6, maintains energy level. And number 7, it helps prevent mood swings, especially during our menstrual cycle. So let me teach you how to give yourself an injection. It really isn't difficult, and you cannot hurt yourself. First of all, remember the injections do not have to be refrigerated, and the sooner you use them, the better, although they have a very long shelf life. Now, to begin with, let me show you where and how to give yourself the injection. The first thing you do is wash your hands and then sit down. And remember, you can't injure yourself. This is really easy. We teach thousands of people to do this themselves. So, wash your hands, sit down, and you give yourself your injection in your lateral thigh, typically the outside of your leg. So here you have the injection, and the first thing you do is you take the cap off. Next, if you choose to use alcohol, this is the time to use it. Now, I'm going to inject myself right through the pantyhose. It will not hopefully give me a runner, but it's perfectly okay to do this. Certainly for you, you won't have pantyhose on. But you just pop it in. It just goes in just like a dart. Just pops right in like a dart. You push it down, and you take it out. And that's it. That's all there is to it. Now, the important thing is how much pressure you hold. The reason I'm holding pressure here is to minimize bruising. It's very important to hold deep pressure over the injection site for 30 seconds. 30 seconds of pressure is enough to seal the injection. Without a good seal, you'll find that you may get a bruise. It's important whether you give yourself the injection or someone else gives it to you, that you always get a good seal with 30 seconds of deep pressure. And that's about 30 seconds of deep pressure. And see, I didn't even get a run. So now I'd like to show you how someone else could give you the injection. They don't have to be certified or trained, just watch this video. It's really simple. Remember, they can't injure you. This injection cannot hurt you. It's perfectly safe. The preferred place to give the injection, and by the way, I'm going to have my husband volunteer to let me give him an injection. Now, he doesn't have a weight problem, but remember, if you take the injection and you don't have fat to burn, it's perfectly safe. It's not going to burn any fat that you can't spare, but you'll get all those other benefits as well. So this isn't just a fat burner, but all those other benefits we talked about earlier. So do come on over, please.
Okay.
All right, now remember when you go to give an injection or someone gives it to you, the best place is the kind of towards the back of the arm. So pretend there's a line from the tip of your shoulder to your elbow and draw it straight on down, and try to give the injection to the back side of that line. And remember, the individual giving this to you cannot injure you. Again, we're back to the cotton ball. If you want to use cotton ball with alcohol, you may. You just rub it. And remember, the trick or the key is to pop it in just like a dart. It's the dart motion where you don't feel it. And I typically pinch the skin because then that makes it, they don't feel it nearly as, you pop it in just like a dart and you push the fluid in and you take it out, and of course, Duke, remember to get a good seal. The seal's important always, otherwise you'll get to bruise, and we don't want you to bruise because then you won't take your fat burner. So these really work well, and remember, you don't have to be a patient to take these or even need to lose weight because it helps in other areas, doesn't it, Duke?
Yes, it does. It doesn't hurt at all, and I like that it helps with my energy.
And cravings.
And cravings also, yeah.
Specifically with the cravings, I find that most of my patients tell me it really helps cut sugar cravings and carbohydrate cravings. Now, there's another way to get more additional fat burning, and that is by taking the pill version of the injection. Remember, there are 7 fat burners in this injection in a B12 base. So the pill version is called Stressed Out and Blast B12. If you take a set in the morning, you'll have about 8 to 10 hours of fat burning. If you repeat it later in the day, you'll have 24 hours of fat burning. You can take your Stressed Out and Blast B12 every day you take your injection, or any day you choose extra fat burning. So thank you for watching, and remember, if you have any further questions, please feel free to call us at our office. And remember, there's 3 ways you can take advantage of our fat burner, and you do not have to be my patient to get these fat burners. Remember, they have absolutely no side effects whatsoever, only tremendous benefits. The 3 ways to take advantage of these fat burners are, number 1, you can order online at our website, georgiabariatrics.com. The second way is you can call our office and arrange for an order to come by and pick it up to take home with you. The third way is to come by the office and let us give you the injection. We always have them available. Thank you so much.